My name is Dr. Robert Takamiya. I'm the Director of Education and Training at the Seattle Prostate Institute. The Seattle Prostate Institute was the birthplace of modern brachytherapy in the United States. One of my predecessors, Dr. John Blasco, performed the first case here in Seattle approximately 25 years ago. Since then, we've been at the forefront of this technology. We have a prominent education course where we train other doctors and residents to perform our Seattle technique for prostate brachytherapy. We also have a mentoring program where fellows from across the country spend a few weeks with us learning our technique as well. So the advantages of brachytherapy are that it is a very convenient procedure. This is a procedure done as an outpatient. The patient does not require an overnight stay in the hospital. The procedure is very short. It takes us approximately 1 hour to perform the procedure. There is no cutting. Needles are used to insert the radioactive seeds into the prostate gland. Therefore, the blood loss is very low. Patients need to be carefully selected for consideration for prostate brachytherapy. A prostate gland that is too large may not be a good candidate for permanent radioactive seed implantation. Likewise, a patient with pre-existing urinary function may not be a good candidate for this treatment either. So a patient who is a candidate for prostate brachytherapy would come in for a consultation at the Seattle Prostate Institute. There they would meet a certified physician who would perform an interview and a physical examination. There is consultation that takes place with the physician explaining the risks, side effects, and complications associated with the procedure. As part of the assessment, the patient would need to undergo what's called a prostate volume study for brachytherapy treatment planning. This is a procedure where the prostate gland is measured and images are obtained. This allows us to construct a 3D volume or 3D model of what the prostate looks like within our planning computer system. We can then virtually place the radioactive sources to determine the proper dose distributions to enable a cure, and these seeds are configured in a way within the carrier needles. The seeds are subsequently ordered in this arrangement to allow this to be facilitated at the time of the procedure. The Seattle Prostate Institute performed the first modern prostate brachytherapy procedure back in 1985. Dr. Hak Ragda traveled to Sweden and brought back with him the transrectal ultrasound technique together with Dr. John Blasco. They performed the first prostate brachytherapy procedure at Northwest Hospital in 1985. Since then, prostate brachytherapy has experienced widespread success. We are very active in the education component. We spend a great deal of our energy training other physicians so that they can learn this technique and take it back with them to their hometowns. Prostate brachytherapy remains one of the most cost-effective ways of treating prostate cancer and is widely used across the United States today. We remain at the forefront of this technology. We have an annual conference where modern research and technologies are presented. We have a regular course where we train physicians from across the world on how to do this procedure. A patient with early stage prostate cancer will often have the decision of whether to proceed with prostate brachytherapy or to undergo radical prostatectomy. The advantages of prostate brachytherapy are that this is a minimally invasive procedure. There's no cutting. Needles are used to place the radioactive seeds into the prostate gland. The blood loss is therefore very low or minimal. The procedure itself is short and quick. It takes about 1 hour 15 for a case. The patients are not required to wear a bladder catheter after the procedure, as is the case with radical prostatectomy. The cure rates between prostate brachytherapy and radical prostatectomy are very similar. In fact, looking at our own institutional data, at the 5-year, 10-year, and 15-year time point, the biochemical control rate, basically the PSA control rate, is essentially identical to that of surgery.